Okay, guys, so we are seeing a patient today who's about to be discharged, but came in with some concerns from primary care doctor about some abnormal symptoms. History that the patient was giving was that he had been previously tested for heavy metals. One of his tests had come back positive. And so they were concerned about some of the symptoms he was describing to them over the phone. And so they went ahead and sent him in for evaluation. 3 of the 4 heavy metals that you would test for are probably things that we're pretty familiar with, so lead, mercury, and arsenic. The 4th thing that comes back apparently on a pretty routine heavy metal screen is something called cadmium, which is not something I was super familiar with. So I figured we'd go over that a little bit. Basically, for acute toxicities of any heavy metals, you worry about a lot of GI upset. Over the long term, things to be concerned about are increased risk of cancer, some altered mentation. In young kids, it can cause developmental delays. And then ultimately, you can end up with organ failure. Specifically, kidneys tend to be the most affected. Of the heavy metals, so lead, we probably most common with that, most comfortable with that. Old paint tends to be the main exposure. Some lead-based toys, so kids tend to be at real high risk for this. Pipes can be an issue, and so making sure like the city has like replaced old pipes, and a lot of times those little like home test kits can tell you whether or not your tap water has increased levels of lead in it. So like those are things you can pick up at like the Home Depot. Pretty frequently offers those. Mercury is something that's found in thermometers. It used to be a lot more common, less so now. Also in things like predatory fish. So if you think of like bigger fish like tuna, or if you ever were to ingest things like dolphin meat, shark meat, those things can all concentrate mercury, and so those can be an increased risk. Arsenic is typically some pesticides, treated wood, water contamination. I think pesticides is really probably the most common form of arsenic poisoning, and then cadmium. So batteries tend to carry it. Metal plating and welding can both be increased risk factors for that. So this guy is actually a welder, and kind of all the same things that you'd worry about for other heavy metal toxicities. So watching out for a lot of the same things. Luckily today he's doing well and is going to be able to go home and follow up with his primary care, but something worth thinking about. Other heavy metals that you would have to send specific tests for include chromium, nickel, thallium, and that one is important today because it is primarily found in rodenticides, pesticides, and some fireworks. So good to know for this holiday season. But yeah, weird thing. Hadn't seen it before. All right, let's have a good shift.